So my name is Jessica Williams, and I'm one of the physician assistants that works with our telemedicine program. So basically what we do is see a lot of the like follow-ups for the offices. So usually like 5, 10-month, even 1-month follow-ups after procedures, or even patients that maybe haven't even had treatments. They're just using more conservative management. It's kind of just a follow-up back to see how they're doing, make sure they're using their compression, things like that. We also will see patients who are scheduled for procedures but needed to do maybe a stocking trial before their treatments to get that approval with the insurance. So it's kind of more of just like a convenient resource for patients, so they maybe don't need to go into the office, because a lot of the patients that we do see are relatively stable. They're not really having many problems. So we're able to, kind of get an updated history on the patient. And if they are, say, having problems and maybe experiencing new symptoms, then we can decide at that point if it is something that maybe they need to come back into the office and be seen again for, or maybe it's entirely not vascular related, and sending them to maybe another specialist based off of those symptoms that we've discussed is what we would do at that point. Prior to the appointment, which I think is important, of course, for the patients to understand kind of what we do, just because we're not a familiar face to them and they have never seen us before. We, of course, have access to all of their medical records. We're able to see everything from the moment that they originally came to the office. So typically what I personally do is I'll always review the last note, review the last scan, review the pictures that were taken at the last appointment, just to kind of get an overview of how they were feeling. So when I do call the patient, it's just like a normal conversation as if they were in the clinic. It's just, of course, over the phone. So I'll kind of touch base on what happened at their previous appointment and how they were feeling at that time, kind of go over the scan as well, and then really just ask them how they're feeling in that moment in time, if anything new has popped up on their legs, if any symptoms have maybe returned, and just kind of get a general idea of how they're doing. And then at that point, that's kind of how I decide on the plan with moving forward, whether that's bringing them back into the office, maybe having them just come back as needed, or doing another virtual like check-in in 5, 10 months, whatever the case may be. So really just a cell phone or even a home phone. I do think a cell phone is a little bit more beneficial, just because sometimes patients may have something specific that they want to show us, like maybe like a wound or like some kind of like new vein or a mark on their leg that they're concerned about that they want us to see, so they can take a picture if that's something possible that they can, are able to do on their own. And then they can always just text us the picture so that we can at least kind of like see kind of what they're exactly talking about. So I do think having at least a cell phone that has that capability is always good, but however, a home phone works fine as well. So a lot of what we do is based off of previous documentation and pictures that are in the note along with their previous ultrasounds. So and also what the patient's telling us. So a lot of it is just based off of the conversation and previous documentation, how we come up with the diagnosis in that current time. So they are typically covered. The appointment, before the appointment, the insurance is checked, and they run the insurance to make sure it's active, to make sure there are no issues. There are some insurances that do not cover telemedicine, and the offices are aware of that, so they don't even schedule them. But of course, things like that can happen. So we'll pretty much always know beforehand if there's an issue, or if, say, a patient is cash self-pay, they aren't someone that has insurance, then we would call them beforehand and be like, hey, and this is my admin that would do this, where she'll call and just let them know this is how much the appointment would be, and then they decide at that point kind of if they want to proceed.